Good evening. Hi, it's Dr. Radialis from the Georgia office. So I usually start with a case or a subject of interest. And since this forum is about how to be fabulous and fertile past 40, I'm going to bring some anti-aging modalities into our talk today. So if you can imagine, any anti-aging modality or treatment, it's going to help not only achieve a more youthful look, but also improve your overall feel, like how you feel, your well-being, and as a result, your fertility. And a lot of times, some of these modalities are aimed at helping your skin look younger or have better tone. Well, the tissue that covers your ovaries and your uterus, it is of the same origin as your skin. So anything that will help the skin look more youthful and have a more youthful function, which is more important, uh, can be extrapolated and used for ovarian rejuvenation. And that is how the PRP techniques were created, as a matter of fact. Originally, they were used by the maxillofacial surgeons and the ortho surgeons, the bone doctors. But then when it started being used by other areas, it was actually the cosmetic dermatologists that grabbed the technique in order to do the vampire facelift and help with rejuvenation of the skin. And eventually, like I was saying, those techniques were then extrapolated and used in the ovaries and the uterus. So today I just want to bring up a few of those techniques that are used in the cosmetic field, but that can be used in fertility. One being red light therapy. So especially infrared, because infrared is going to penetrate a little deeper. So it is used for blemishes in the skin. It is used for discoloration and wrinkles, creating that youthful look. And it's believed to do so by increasing collagen and elastin production in the skin and stimulating the mitochondrial in your cells, directly stimulates the mitochondrial to work better. So it's kind of an energy boost for those cells. It activates the cell and makes it work better. So if you actually put infrared light in your abdomen, close to your ovaries and your uterus, you are going to get some of those benefits, especially if your abdomen is on a thinner side because of the penetration. I believe infrared light can go down to 18 millimeters or 2 centimeters. So there'll be some benefit to those organs by using infrared light in that area. If you are currently trying to conceive, then I would encourage you to use it in the follicular phase of your cycle because we don't really know long-term effects on a potential embryo. So what does that mean? Follicular phase means from the time you get your period to about 14 days after the first day of your period, where most women do ovulate. Another along the same lines is infrared sauna. There's a lot of benefits to infrared sauna, and including the ones that I have mentioned, with the pads in that abdominal area. But then getting in the sauna, your body will get heated up and stimulated from the inside out, and heat shock proteins, which are a special type of proteins, get creeps up. It gets stimulated, and those proteins cause they're natural antioxidants, so they go and clean up the damaging radicals in your system. So these little particles that are created as a byproduct of our metabolism and toxicity and so forth. And so it cleans them up. They also help your natural proteins keep their structure It also stimulates the mitochondria, which is very important for fertility. That's one of the reasons we take CoQ10, and therefore causes general well-being, detoxifying, and anti-aging. Now, it is very important that if you are actively seeking, you use any heat source, so either an infrared pad or a sauna, only in the follicular phase of your cycle, because again, both light therapy and heat might be an issue with a developing embryo, especially the heat portion of things. All right. It is known that heat is not a good idea to an embryo in development. On the other extreme, the extremes cause the same effect. And some of you might have heard of people like jumping into ice water. It will have similar effect on the heat shock proteins. And it will also have the same effects of stimulating your immune system to clean up house and work better in the immune system. It's directly related to the healing process. So those are a few things that you could do to improve not only your youthful looks, but your youthful fertility. All right, so let's see what you guys have to say. So I have a question here. I had my blood work today. Estrogen was 12, FSH 34, and I had birth control pills for 8 days. Do I need to skip this cycle? I would definitely skip this cycle. Your FSH is higher than 15, so it's not conducive to good stimulation. It depends what you're trying to accomplish and what your AMH is. You might want to skip this month in order to do better priming. Compounded ethinyl estradiol, this is a question I had recently by a patient. I know there's some doctors out there that prefer that. I haven't really seen a significant improvement in terms of baseline, compared to using estradiol and progesterone, but you might want to do some sort of estradiol. I've had really good results putting people on estradiol patches, for example, and then bringing them back and keeping them on estradiol throughout their stimulation, especially if they have very low estrogen at baseline and high FSH. Okay. I had another patient today ask about the progesterone protocol. We've been using it more and more on patients that tend to have a lead follicle. And this might be something that you might want to do as well, is instead of loading people up and, getting them on cetrotide, then you can do Provera, so medroxyprogesterone 10 milligrams, and that will help with your overall situation. You can do the estrogen patch and the Provera, and then stay on the Provera, bring those levels to a baseline that is adequate for stimulation, and start the injectables. Yes, so you've used the patches. You can go down on the estrogen patches, and then keep at least either the patches or vaginal estradiol throughout, because it seems that your estrogen is so low at baseline, and that was after birth control. Usually when I put people on estrogen before starting a cycle, you will see a higher estradiol at baseline. So even after 8 days of birth control pills, and those will have estradiol, your estrogen was only 12. So you do need a little bit more, and the patches, the beauty about the patches is that they do come in all, I think there's like 6 or 7 different doses. So you can go lower. If the higher patches suppress you too much, you can go lower, but it'll keep a steadier level in your body than the pills. And then during the stimulation, sometimes I'll switch to vaginal estrogen, especially if you're if you're not doing Provera. If you do Provera, you can't do a fresh, but if you're able to get off the Provera and go to the cetrotide, for example, I sometimes keep people on vaginal estrogen to get a little bit into the bloodstream, but then help the lining. Because what I see with low barium reserve patients is that their lining, especially they're doing letrozole together with injectables, is very, very thin. So if you've used the 0.1 milligram, you can go down to like 0.0375 and see how you do with that, and consider doing the Provera protocol, and then and see. The other thing that you could do after you're able to get that FSH down is consider a Lupron flare protocol as well. Okay. Very good. All right. Well, I guess we're going to have a short video today. I hope that you all had a great Thanksgiving, and that tomorrow is the 1st of December, the last month of the year. I hope that 2022 has left you with a lot of blessings, and that you're getting ready to receive the ones from 2023. I had a patient that we were talking, she's getting ready to transfer her donor embryo babies, and we decided that she was going to delay till January because it was going to be a new year, new baby. So all of you out there, many blessings, and I will see you guys next week. Bye-bye.